This video looks at the movement analysis for the ankle joint. Now, the ankle joint is a synovial hinge joint, and hopefully you know that means it only has movement in one plane, and that would be the sagittal plane. So we're going to look at the two movements that occur at the ankle joint and the muscles that cause those movements. You can see that plantar flexion and dorsiflexion are the specific movement names at the ankle joint. Effectively, they are like flexion and extension, but for some reason they're called plantar flexion and dorsiflexion. So, when the ankle angle is increased, i.e. when you're pointing your toes, this is plantar flexion. The agonist for plantar flexion is the gastrocnemius muscle. This is the larger of the two calf muscles. And you can see on the diagram here that when gastrocnemius contracts, it pulls on the Achilles tendon, which attaches to the calcaneus bone, your heel bone, and that causes the foot to be pulled downwards and the angle at the ankle joint to increase. So that is plantar flexion caused by gastrocnemius in the sagittal plane of movement. What we can also see here is soleus or soleus. This is the smaller calf muscle and it's actually deep. So gastrocnemius is the superficial muscle, soleus is underneath that, so it's considered deep. Soleus is a synergist in plantar flexion, so it helps gastrocnemius plantar flex at the ankle joint. It's not big enough to do it on its own. It's a smaller muscle that works with gastrocnemius to assist it as a synergist. Then we've got dorsiflexion at the ankle. Now this is when the angle at the ankle is reduced or decreased. You can create dorsiflexion by pulling your toes upwards towards your tibia, towards your shin, or by lowering your shin downwards towards your foot. So if you were going to do a squat, you would basically lower your body and your tibia would come forward and reduce the ankle angle. So dorsiflexion is caused by tibialis anterior. And again, this muscle vaguely makes sense because this muscle is on the front of the tibia bone. Anterior means front, tibialis refers to the bone, the tibia. So tibialis anterior, the muscle that's on the front of the tibia. And when that muscle contracts, it will either pull the toes up to dorsiflex at the ankle, or it will be part of helping the tibia move downwards to reduce that angle.